My name is Carol Monaghan. I'm the chair of the All-Party Parliamentary Group on ME. Many of you I know, many of you are meeting for the first time today, and it really is an absolute pleasure to welcome all of you here to Parliament this afternoon for the launch of our All-Party Parliamentary Group report, Rethinking ME. This has been a report that has taken nearly 2 years to produce. It was made rather more difficult by the pandemic and gathering evidence, but we have got to this stage and we're really happy that we've done that. Now, I first became involved in ME when I was approached by constituents who described their battle with the condition itself, but also their interactions with healthcare professionals and, of course, welfare providers. Often these experiences
Thank you. I just want to take a couple of minutes at the start just to tell you about someone that I know. Someone I know very well. It's a member of my family, and I'm not going to use her real name. Let's call her Sarah. I've known her from the day she was born, and like many children, a fantastic child and very energetic and did tons of things to make everyone around her happy as well as being happy herself. And I distinctly remember hearing from her mother, who was very close to me, that when she was around 12, she was 12 years old, Sarah was 12 years old, the things started to change. Unexplained started to change in how she was behaving. She became tireder and tireder. She used to be one of the earliest to get up in the house, wake everyone up, and just would stay in bed longer. Sometimes she couldn't even get to sleep, so it was always the same issue. And she was someone who was doing academically brilliantly at school, but especially at sport, especially netball, which is her favourite sport. In fact, she was head of the school team. And she just, within a week, she just couldn't do it anymore. And she just changed completely as a person. Of course, she was the same person, but in terms of what she wanted to do, she became so frustrated that she knew exactly what she wanted to do, but she couldn't anymore. She just couldn't muster up the energy. 3 or 4 hours at school, she'd be so tired she'd have to come home early. So the school said, oh well, why don't we just have her in the mornings and she can come home at lunchtime? Not really thinking about what's the impact on her education, what's going to happen, what does it mean for the long term. She couldn't do sport, no special provision or anything was made for that. But I thought, worst of all was how she was treated by the NHS. Not by everyone. I mean, there's some clinicians that really wanted to help and do their best and try to find out what the problem was. They thought maybe it's some allergy or something, she's got some food allergy or something, and wanted to test for one particular allergy, one after the other, test after test. Sometimes the doctors thought maybe it's she just actually, maybe she's just not getting enough activity and needs to go out running every day or some other activity, and that would boost energy. Of course, none of that was the problem. Eventually, she was just told by her clinicians that she's got ME. That's what she's got. Her parents were told her, you've got ME. And I have to tell you, it just really felt like that the clinicians really weren't doing their job. Certainly not well enough, because it felt like it was like the default option, that when you just can't really find out what the true cause is, let's just call it ME/CFS, and that's a sort of convenient bucket. Let's just stick this child in that bucket. And of course, that was unacceptable for her. It's unacceptable for anyone in this country who's gone through something similar. But as parents, and some of you maybe here are parents of children that have ME, maybe you have ME yourself, another level. And perhaps you recognise some of what I've said. Now, this person, Sarah, she's 18 years old. Just had her 18th birthday a few months ago. And still, no improvement. She was put a year behind in school because of this, and is desperate to sort of get on and do things. And her whole friendship group has had to change because her friends are moving on to university and other places. And that's understandable, but of course their friends are going to friends are going to carry on with life, but our whole life has changed. And there's really no end in sight to this. And that's the most, I think, the most frustrating, the most worrying thing of all for her parents in particular. There's no end in sight in this. And that can't be right. It just cannot be right. And I have to say, I agree with everything you just said a moment ago. And there are some clinicians, I say, that try their absolute best, but I just don't think the whole system realises, has not realised how serious this issue is and how it's been neglected for far too long. Now, I did learn about ME from my family, as a member of Parliament. I met people, my constituents that had ME, CFS, and I remember meeting them or meeting their parents and starting to think about it. And even before my family member Sarah went through this, I talked to some of my predecessors, well, actually both my predecessors, about this issue, and they listened and responded. But I have to, I don't think the system has responded enough, anywhere like near enough. And now I've got no excuse, because now I'm the Secretary of Health. After all the other jobs I've gone through in government, this is the one where I can properly, truly do something about this. And it's, as you said, Carol, it's about making sure, is there a proper diagnosis, a proper test, try to find out what the problem really is and how can it be, what are the answers, solutions. Sometimes, I remember Sarah was telling you, maybe you've got a rare disease, then well, if that's the case, I know it's rare, but let's properly test for all the diseases that we know about. And we are making some progress. The ME work is groundbreaking, it's world leading, but it will take years to get results. It takes time, but at least the work has started. The government's put some £3 million of funding into that. There's some research that's taking place, and I think there's some £2.5 million of government funding. The nice guidelines, the changes there are really welcome. But all of that taken together.
Though I have no place in this world, my life is not worth living. These are the words from my own son. A year after I joined Action for ME, my son, who had just turned 11, he's now 19 and a half, got a chest infection and he failed to recover. He was later diagnosed with myalgic encephalomyelitis, or ME. We held on to hope for improvement, hope for understanding, and I can tell you there wasn't a lot from people close to us, hope for recognition, hope for some kind of real treatment, and even hope for a miracle cure. After decades of ignorance, injustice and neglect, children and adults with ME and their families finally have real hope. Last year we had the long-awaited revised NICE guideline. And that process, as we've heard, put people really very much at the heart of it. It was a very robust process, which was really needed. It gave so much hope. The hope that change might now be a reality shone through even stronger on the 12th of May. The first World ME Day, launched by the World ME Alliance, and Sean, wherever you are, thank you for all your work you did for that. The Alliance is a collaboration of national ME organisations. We've got a number of countries working together in recognition of what we can create together. We're united in our ambition for the recognition of ME and leadership, not just at governmental level, but at World Health Organisation level. And here in the UK, the ME community felt that hope as the Secretary of State for Health and Social Care announced the intention for a cross-government delivery plan with people with ME at its very heart. The hope for research that leads to improved treatment and care is loud and clear. So also on the 12th of May, a report was launched. You can find it on the PSP website. It outlined the top 10 plus priorities that people with ME and clinicians identified through the ME CFS priority setting partnership process. The UK Clinical Research Collaboration and the DHSC will now work together in partnership with researchers, clinicians and people with ME to drive research forward. That's the first. As a country, we have now seen how we can respond to a crisis and accelerate research, which leads to treatments. We hope to see that equity for ME. It's been long awaited. Last week, Dr. David Strain, who's our Action for ME medical advisor, and I visited a clinical research foundation in Nevada. We learned about the research that's taking place, we got to meet patients, we observed clinics, and we got to talk to one of the world's leading ME doctors, Dr. Dan Peterson. And I have to say, we saw the range of tests that were being done that we need in this country. We saw the treatments that are being trialled, the drugs that are being given. We saw the impact that had for some people who went from being in bed to actually being in the clinic, having an infusion and having some level of quality of life. We have to make sure that this happens in this country. For some, this is all sadly too late, but we have an opportunity to ensure that no other child with ME feels like my son did, and no other parent like me has to hear those words. We have an opportunity and a moral duty to ensure that together we don't just provide hope, but we deliver real, long-lasting change for and with people with for people with ME. And I was just talking to the Secretary of State and said the words are easy bit. So I'm holding all of you and myself to account to make sure that in the next couple of years, the next couple of months, we see something happen and we ensure that we're not standing here again in another 10 years, how long I've been with this charity, having the same conversations.